Now, a WBAL News Radio Town Hall special, The Coronavirus. Here with Brian Neiman is C4 on WBAL News Radio 1090, FM 101.5, and the WBAL mobile app.
We come here this morning for our third virtual town hall meeting with our partner, GBMC Healthcare. Joining me this morning is Brian Neiman. Brian, good morning.
Good morning, C4. Glad to be here again.
Look, let's talk about where we kind of are today, as we will be joined by guests throughout the show from GBMC Healthcare, Dr. Timothy Doran, who is pediatrician chairman of the Department of Pediatrics at GBMC, Dr. John Chassar, president and CEO of GBMC Healthcare, Molly Hyde, MHSCIC infection control practitioner at GBMC, and Dr. Neri Cohen, who is a lead clinical informatics liaison and vice chair at GBMC. And one of the things, Brian, we're going to be focusing on today is what comes next with our kids. What about school? What about camps? What about hospitals doing telehealth? The backdrop that we stand here today is that more than 2 million Americans have been tested positive for COVID-19 coronavirus. Almost now 117,000 Americans have tragically passed away, according to Johns Hopkins University. We're beginning now to see in Florida, Texas, and Arizona daily records for new positive cases, while Maryland, they're part of 21 states seeing this jump. 21 states, including us, Maryland, are seeing downward trends as it relates to this. And in China and in Japan, Tokyo, Beijing specifically, Brian, we're looking at a potential second outbreak and fears of that. So that is kind of the foundation for how we get here, Brian.
It is really amazing because, a couple of weeks ago you reversed that. We were in bad shape in Maryland, and those other states that are seeing the hot spots were in good shape. So we're still trying to figure all of this out. But it is a great segue because we're only a couple of weeks away, really, from having to have a plan, at least for the schools and what it might look like. So to have Dr. Timothy Doran on the show right now, who is head of the Department of Pediatrics at GBMC, one of the big silver linings, Doctor, has been the fact that kids haven't been as impacted as much as adults in the coronavirus. Do we have an idea of why that is and how susceptible kids are to this virus?
Yeah, Brian, nice to be with you this morning. We don't know. I mean, it's the million-dollar question as to why children do not get that. They actually don't get this illness as much as adults. And if you look at various countries, it ranges between 2 and 4% of the total cases will be in children up to 18, children and adolescents up to 18, and they comprise in those countries, anywhere from 15 to 20% of the population. So they clearly are not getting it as often, and when they get it, fortunately, they don't get very sick from it. Clearly, you read in the news about the tragedies that occur, and that does happen, but it's rare. It's very rare.
Dr. Timothy Doran, pediatrician chairman of the Department of Pediatrics at GBMC. This is C4. Dr. Doran, when it comes to the news we were getting about this Kawasaki-like disease about a month ago, we haven't heard much about it. What do we know now, and should parents be worried?
Yeah, we know now this is a brand new illness. We have never seen it like most of what we're seeing in the last 5 months. It's not like measles that we've had 150 years of experience with. This is a brand new illness. So these cases were first described in Europe and England, and now we're seeing it in this country. And most of them occur a few weeks after the acute illness, which may not be very severe. And it is like a Kawasaki. It's an immune-mediated illness, and fortunately, most children are actually doing okay. Some do not. But again, it's very rare considering the total number of cases we're seeing. But it gets attention because it's brand new and nobody's ever seen it before. So that's the issue with that. But it's really, really rare.
So the fact that, kids are not getting it as much and it doesn't seem to be as severe, we're lifting some restrictions. They've been cooped up inside the house for months, Dr. Doran. I've got 3 kids at home. They want to be outside. They want to play with their friends. I want them to play with their friends. What do you recommend right now for parents when it comes to play dates, whether it is, playing tag, playing games, or riding bikes, or even at the playground itself, riding slides and, swings and stuff like that?
Yeah, so that's a great question in terms of the social isolation that these kids are experiencing. It's not great for their development. First of all, the playgrounds are really should be off limits. That's number one. But number two, being outside is outstanding and terrific, and I really encourage parents to get their children outside and choose to observe the social distancing, physical distancing, if you will, in terms of other children. But certain sports lend themselves to being apart. Baseball, you're not crowded all together. Other sports that where you can maintain distance will be great. So, yeah, I mean, children, especially in the summer here, to get outside and be outside a lot of the day would definitely be encouraged. In terms of the infectivity, it's a great question, too. We know that fewer children get this, but we know certainly in younger children, they interact with more other children more than adults. So adults may interact with fewer people, but children, even though they're less infective, probably they interact with more children and could be as overall contagious, basically.
You're listening to WBAL Coronavirus Town Hall Special number 3. And we've been doing this monthly in a great partnership that we have with GBMC Healthcare. We're speaking with Dr. Timothy Doran, who is the chairman of pediatrics at GBMC. How important is it, Dr. Doran, for parents? I know they've been concerned about taking their children into public places, but they've got to keep up their vaccines and their schedules, don't they?
Yeah, that's a big concern we have. In the last 2-3 months, we've fallen behind on a lot of all the vaccines, and we need to do some catch-up work, especially around measles, because measles is highly contagious, and in order to achieve herd immunity with measles, you need about 95% of the population immunized or have had the illness in their past. That's much higher than other illnesses that are not as contagious. For instance, polio, we only need about 80% to achieve herd immunity. So if we drop those vaccinations back, we're potentially having outbreaks of measles, which we certainly don't want. Throughout the world, there are over 100,000 children who die from measles, but not in this country because we're well vaccinated. But it's still a risk that we're worried about, and we're playing catch up now and trying to get kids in who missed their shots, and we need to recruit them to get back on their schedules.
Talking with Dr. Timothy Doran, who is the head of pediatrics at GBMC. So summer school has been given the green light for 10 to 15 kids in the classroom at the time, according to the head of state schools. We are a couple of months away from school. We hope that it will start in August for some counties that are going back to school, some after Labor Day. But if you were to make a recommendation, I know there's a lot of time ahead of us. What would you recommend regarding going back to school in the fall, Doctor?
Well, again, it's the physical distancing. So, it's going to have to be staggered. It's going to be much smaller class size, which is great for children. The personnel to do that is going to be an issue, but they're going to have to be careful, and they're going to have to watch what happens with the overall rate. If we start ticking up again, then we're going to have to reassess the strategy of doing that. But basically, staggering classes so that not all the children are in the class at the same time. Interesting, I saw some slides from China, and they actually, on the younger kids, made them wear hats with almost helicopter blades on top of it so that they wouldn't get near other children. But the challenge is really those younger children and keeping them apart. In a high school, you could see where if you had compliance, you could keep the students apart, but it's going to be more challenging for the younger children.
Dr. Doran, final question for you, and that relates now to parents. We've been talking about children because it's your specialty, but parents have taken on so many roles throughout this and are really facing a lot of stresses and everything else. What advice do you have for parents who've been around their kids, Brian Neiman, around their kids a lot over the last couple of months?
Yeah, I mean, I'm hearing that a lot in my office, and parents are really burnt out from this. I think that one of the pieces I would give them is, there's this concept we have of continuous partial attention, where the parents are with their children, but they're on their phones or they're doing other things. What I would say is try to make half an hour or twice a day where you just totally give them your complete, uninterrupted attention. and then the rest of the time, let them play. Let them be, let them find imaginative things to do on their own. We know that that's really great for their development, and somehow for the parents to get some relief themselves in whatever way they can do that.
Well, real quick, before you go, Dr. Doran, should parents then, who are listening, should parents talk to you, their pediatrician? Should they communicate with you these concerns?
Oh, yes, all the time. I'm hearing it constantly, especially two parents who are both working from home and their children are at home. I mean, it's a tremendous stress on them. And if the schools and camps don't open up, I worry about that stress just being too much.
Yeah.
So it's a really tough decision, and I don't think anybody has the exact answer yet.
Very good. Doctor, great to have you on. Really appreciate you coming on the Town Hall.